All right, welcome everyone to the first FFWI Wisconsin Coalition State Quarterly Collaborative Meeting of 2025. Somehow already over a week into 2025, so exciting for everyone to be here. If you haven't been a part of the State Quarterly Collaborative in the past, in 2024 or previous years, it was previously run by Susie and Ann over in Milwaukee County. But we are kind of putting it under the FFWI Wisconsin umbrella this year and moving forward. So exciting to be leading this. If you don't know me, my name is Suzanne Morley. I'm a health promotion program coordinator at the Wisconsin Institute for Healthy Aging, and I coordinate the FFWI Wisconsin Coalition. And I would love for everyone else to introduce yourself in the chat with your name, your organization, and your favorite board or card game. So I'll just give everyone a little bit of time to do that, to break the ice and get us started. I was playing a lot of board games over the holidays, and I have a 3-year-old, so my favorite board games are kind of a little bit more elementary, and we're really enjoying one called Sneaky Snacky Squirrel over the holidays, which is kind of fun. Annette from Sheboygan County, Quiddler. I've never heard of that one. See, Alyssa, Uno, or Yahtzee. Those are classics. Tina, Dominoes, Ashley Scattergories, Paul Euchre, Amy, Uno. Yep. I see a few more for Uno and Yahtzee, Risk, Crimes Against Humanity. That's always a fun one. Phase 10, another one I haven't heard of. Sheep's Head. We'll count it. I don't know if I've ever played that one. Another vote for Yahtzee, Shut the Box, Block Us. I haven't heard of that one either. Mary, Scrabble. Scrabble is also a good one. I haven't played Scrabble in so long, but I love that one too. Kim, your 5-year-old has been winning Chutes and Ladders. That's a good one. We got that one over the holidays too, but we haven't really finished that one yet. My 3-year-old doesn't have quite the attention span for that one. Yahtzee and Candy Crush. Dungeons and Dragons. Yep, definitely counts. Awesome. Well, thanks everyone and welcome. Thanks for joining. We do have a pretty packed agenda for the day, so I do want to kind of get right into it. So you'll see on the screen we have, first we'll kick off with some presentations and talking specifically about strategies for reaching underserved populations. So we have a whole lineup of speakers that you can see on the screen, and then we'll have some discussion. I'll give some FFWI Wisconsin Coalition updates, and then allow some time for everyone on the call too to give some updates, and then we will wrap up. So I'm looking here, and I'm not seeing Shari on the call yet, so I am going to skip, if it's okay, right to Mary Wolf. So Mary, if you are ready, you can take it away.
All righty, here I am.
Do you have any slides to share, Mary?
I don't.
Okay, that's okay.
They're at my old job.
No worries.
So this was a project that I worked on with WIHA several years ago. We were trying to find a way to adapt the materials that would be more accepted into the tribal communities here in Wisconsin. So we had a grant actually that helped us do this, but we were able to train some people from different tribes, along with myself, to become facilitators. And let's see, they were... Myself, I'm from the Lakota tribe, Vera Hubel and Tammy Miller from Stockbridge Munsee tribe, Cassie Hurd from the Ojibwe Odawa tribal descent, Carol Bogda from Oneida tribe. And then we also had input from participants from Stockbridge Munsee, Ho-Chunk Nation, Lakota and Red Cliff Band of Lake Superior Chippewa. So it was really good feedback. We met quite a few times in going over the curriculum. We went through the training first, and then got together on how we could adapt this. And we met with our elders in our communities. that what would they suggest that we do? And so for one thing, what the concern was, why aren't tribal people taking advantage of this stepping on program? It's such a great evidence-based program. Well, in our culture, when a person says that someone has walked on, that means they walked onto the spirit world. And so we're thinking that a lot of people were probably concerned that this is meaning that they're getting closer to walking on. So from the conversations we had, we changed it to say stepping strong. I later found out that that was the Spanish version too, in the interpretation of it, translation of it, was that it was stepping strong. And that gives us a much more empowering feeling to do this. So we held workshops over in Hayward, up in the northwest corner of the state, and invited tribal members. And they really enjoyed it, but they also suggested, could you take this over to St. Croix tribe? Could you take this to the other tribe? And I'm like, well, my partner is actually employed right here in Sawyer County. It was Jody Olney, another master trainer. So we did have really good results, and I still run into the people that we were with that still comment about it. I'm still doing this or I'm still doing that. So it's lasting. But the way that we marketed it was we went to any meeting that there was, where there was meetings for elders in attendance, to talk about the program, give a few demonstrations of what it was, and let them know that there would be things that they could earn in this. And so one of the things that we let them earn was leg weights, the weights for that we were going to use in the class, but showing them how they could start out with low weights and then gradually move up as they got stronger and stronger. Another thing that we did, well, the reason I don't have slides is because when I was working on this, I was working at Great Lakes Intertribal Council, and that's where we worked with all 11 tribes in the state. And so I was able to go to each tribe at that point, and help out. But now I've taken a job over at Le Coudray, and all of my files are back at Glitzy. So I'm sorry I don't have those. But we changed the logo on there to include the tribal logo. At that point, it was the Glitzy logo, and then whatever tribe we were working with. So we did that. And some of the photos of the examples that we had, we switched those out to have tribal people represented in there. And it was more culturally acceptable. I mean, because it was our own faces that we were seeing in there. When we were talking about the different devices that we could use to prevent ourselves from falling, walking sticks was good. We also had someone come in and demonstrate how to use the walking sticks they use on the trails. Very similar to walking sticks that traditionally people have used out in the woods. So we did adaptations like that. The pictures of the shoes that we used in there, we showed some really pretty beaded stiletto shoes. Excuse me. I'm getting really dry. Anyway, Shannon, could you take over?
Yes, definitely that time of year when colds are coming out. I know my family is sick too. So thank you, Mary. If there's anything more that you want to share, feel free to jump back on. And at any time, if there's any questions, feel free to either come off mute or drop any questions for any of the presenters in the chat. I'll give just maybe a few seconds for any questions or comments on what Mary was sharing about reaching tribal elders with the Stepping On program or Stepping Strong program, I should say.
Oh, one other thing. I think I'm done with it. One other thing is that when we have the group, when there's smaller groups like that, they kind of get off topic and they like to start visiting about what they're doing or something like that. And in the tribal culture, it's very rude to interrupt an elder. So we join in on the conversation and try to get them back on topic that way. But anyway, I think I better go because I'm getting choked. Thank
Totally
you.
understandable. Thank you so much, Mary, for sharing about the tribal adaptations. If anyone is interested in seeing the tribal adaptation booklet for Stepping On, it is, if you are a Stepping On facilitator already, it is on the WIHA website under the password protected facilitator resources section. So if you're just interested in looking at it and kind of seeing what those adaptations are that Mary was sharing about it, you are welcome to do that. I see just a comment in the chat about liking the name of Stepping Strong and having that feel more empowering. So thank you for that. All right, I am going to, oh, yep, and I see Jill's comment too about Mary. We'll be talking more about the cultural adaptations at the Healthy Aging Summit that we have hosting on May 15th. And we'll talk a little bit more about that towards the end of today's meeting. All right, I'm going to move over now to Ashley Hillman and Erica Bowie, who are going to talk about what the work that they are doing in Dane County to reach underserved populations. So Ashley and Erica, take it away.
Thanks, Suzanne. It's good to be here today. So I'm Ashley Hillman, and I work with Safe Communities in Dane County, and I coordinate Stepping On for Dane County. And then I'll let Erica introduce herself, and then we'll jump right in.
Hello, everyone. My name is Erica Bowie. I'm an older adult program and outreach coordinator at the Madison Senior Center.
So just I think to provide a little bit of context, I coordinate Stepping On, and we've had this conversation many times that Stepping On is amazing, and it may not also be the program that reaches all of our older adults. So what we have done in Dane County is we've tried to take the pieces of pieces of Stepping On, and then get those pieces out into the community. So whether it's having an occupational therapist come and talk about home safety over lunch, or have a physical therapist come and demonstrate exercises and provide lunch, in just kind of like a 2-hour time slot at a faith-based organization or senior housing. We've tried to start doing more of that. And, I met Erica a few months ago and realized that we had actually met many, many years ago, and now our paths were crossing again. And we have started this really amazing collaboration, so that we're leveraging our resources. And Suzanne, if you could go to the next slide, please. Oh, I guess maybe the next one. I'll talk about the safe community side of things, and then Erica could talk about the Madison Senior Center. But through Safe Communities, we have the Falls Free Dane Coalition, which Erica is a part of. And we have a lot of great content experts in that coalition, and we look at how to reduce falls at both the systems level. So, EMS, healthcare, are we referring? Are we providing helpful interventions and programs for people? And then also we provide resources and programs on falls prevention that are accessible, and they're ready to go. So that's kind of what we can bring to the table. So Erica reached out and has a really great relationship in the community, and I'll let her talk about that. But that's kind of when everything came together for us to be able to start this partnership.
Yeah, so I'm absolutely excited at our relationship with Safe Communities. I was hired just 6 months ago by the City of Madison to be a program coordinator at the Madison Senior Center. And I was tasked with taking over some of the programs that happen at the Madison Senior Center, but I'm also tasked with going out into the community and providing programming for some of our underserved BIPOC older adults. And the best part about the hire was that I did this type of work in the past. And so I had a lot of relationships established already. So the older adults just kind of welcomed me back with open arms. And I had a meeting with, well, one of my strategies was to go into apartment complexes instead of like community centers. I wanted to reach the really underserved older adults. Um, I went into apartment complexes that BIPOC older adults, where there was a group of BIPOC older adults that lived there, and introduced myself again and talked about like what type of programming they would be interested in. And one of the spots I had mentioned that they had like a high amount of falls. Well, they actually said that the number one ambulance call was for falls for older adults in that complex. So I thought about Ashley because someone just kind of put Ashley on my radar in a different meeting. And I reached out to Ashley and we did a lunch and learn program at that apartment complex. And it was a wonderful turnout. Everybody really appreciated the fall prevention program. The educator was magnificent, and we spent like a nice amount of time just answering questions at the end. And they are really interested in having safe communities bring in some more fall prevention education. But I'm also working on getting lunch and learns. We have one set up coming up in the end of January, and I'm interested in safe communities bringing some more fall prevention education in other areas that I am connected with that older adults live. Like I said, my strategy in this position is to reach those isolated, underserved BIPOC older adults. So again, I really love our collaboration, and I don't think that fall prevention education would be in these spaces if it wasn't for the safe communities having the ability to provide the lunch and learn and myself going out there and finding these spaces.
I totally agree with that, Erica. It's been just kind of like the perfect collaboration. And we talk about this also that no one organization can do this on their own, and you really do need to leverage your strengths and your community members' strengths and partnerships. And I feel like this is happening, and it's doable, I think, because of that. And I think we can reach more older adults because of that. And I think, just have one more slide, Suzanne. If you, we do have a picture from that event that Erica was just talking about. So we at Burr Oaks, at the beginning of November, we had a lunch and learn event, and it just, like she said, a huge success. So we look forward to having more of those in 2025.
Awesome. Thank you, Erica and Ashley, for sharing and all the work that you do. It's really that relationship building, like you said, and then really going out to meet people where they're at instead of, kind of expecting them to come to you. So really reaching those underserved, like Erica said, isolated older adults. That's awesome. Any questions, comments for Ashley and Erica? I'll leave some time and space for that before moving on to hear from Simone. Okay, thanks again. And I'll pass it over to Simone with the Aging Disability Resource Center of Northwest Wisconsin to share about what they're doing over the northern part of the state. So Simone, whenever you are ready.
Hi, sorry about that. Um, I have a slide today that I'm going to share, if that's all right.
Yep, you have sharing abilities, otherwise I can share for you.
I was sent a request, it seems.
Okay.
Perfect, wonderful. Let me make sure that I've got this on the right screen here that folks can see it. Sorry about that. I don't do a whole lot of sharing slides. A lot of our programs that we do are in person, so I don't do a lot with virtuals. All right, are we seeing that okay, everybody? Wonderful. Okay, so my name is Simone Stein. I work with the Aging and Disability Resource Center of Northwest Wisconsin. We actually cover two counties, Polk County and Burnett. We're both about 45 minutes northeast of the Twin Cities in Minnesota. It's pretty rural. So as much as I want to talk about our successes in this, I'm going to have to talk a lot about our failures too, because it's going to be a little more enlightening here. We've done a few education efforts with our public library, Balsam Lake, which is the public library that's in the same town as our government center where our ADRC is located. We also have the other one out of county. I'm going to be talking about Polk pretty much exclusively. There's a few things that I'm going to get into later that will explain why we don't do a lot of work for fall prevention in Burnett yet. So when we did with this Balsam Lake Public Library, we tried to host just a very generic education on fall prevention. As you can see here, we had basic tips, which a lot of those I actually pulled from Stepping On. Some of those just really fundamental, like you can use this in your home. We did talk about Stepping On specifically and did an overview of that. We ran one a little while ago, and then this event happened between the prior one and the next one we were trying to get off the ground. We also brought one of our information and assistance specialists with us who was able to do a little bit of more like in-person work with her. We only had one person come, which was disappointing. But what worked out really nice with that one-on-one with her is that she did end up getting very engaged. She wanted to register for Stepping On, but ended up not. She did sign up for something else that we hold called Eat Smart, Move More, Way Less. And so she came back for that one. So as much as it was disappointing to have a small turnout, it was really nice that we were able to get high quality interactions with her, which seems to be a little bit of what we're running into is getting that attendance being so small. In winter months, we lean a lot on newsletter just to kind of get that information out to people we usually run an article or two on like safety when you're dealing with ice. Things like that. We also have snow removal providers that sometimes people ask about. Being very rural, a lot of folks, they don't have people shoveling sidewalks. They don't have, the ability to, get the snow off of their driveways and things like that. Some of these folks have half-mile driveways. And so that's something that we try to make sure that people know how to deal with that before it gets really bad and becomes a risk. So Live to Be Healthy is a program that we run because Stepping On is a little bit newer for us. Our first class was just back in July. We have a couple other programs that we really try to promote in addition to that to kind of encourage some of those other things that can help with fall prevention. You teach a lot of technique and exercises and Stepping On, as a lot of you probably know. But a lot of those things can carry onward too after the fact. You want to make sure that you are getting that exercise, you are, keeping on with your balance and things like that. So we run Live to Be Healthy, which is kind of nice. It's based on the Arthritis Foundation exercise program, and we contract that out to another group and have them do that for us, which is very helpful because a big barrier that we face with the rural area is finding people to run these programs, just finding volunteers, finding even staff that is around here. There just isn't enough bodies to offer all of the programs that we want. And so we've kind of been doing a lot with them. And then Stepping On has been interesting because the July series was it was very successful, but it was very much a last minute success. In the very beginning, I went back and I called. We had a wait list, and then the gal before me 3 years ago had a wait list. And so I went through and I called everybody, going as far back as like 2017. Most of them were not interested, but I actually had 3 or 4 people, like I said, going back as far as 2017 that were still interested in this program. So when you're having a hard time gathering enough people to hold something, it's nice to be able to have other places that you can go back and draw from. So we did have 11 enrollees, only 9 attendees. We held this at the Osceola Public Library, which Osceola only has about 1,700 residents. The one that we're holding right now that just started the second, they only have about 2,900 residents. That's our biggest city in the county, is 2,900. So a lot of times we try to hold these classes in those bigger cities because that's where you're getting most people coming to. Unfortunately, something we run into a lot is that people have issues with transportation. That Balsam Lake event, the nearest town from that is 20 minutes. People don't want to drive 20 minutes to come to the library to listen to you talk about how to not fall down. We get a little bit more traction on things like stepping on. But like as the attendee trends are going to kind of show you, we're seeing primarily women. We've only had one man. The numbers are pretty similar for both of those classes. As you can see, we had 12 expressed interest, 9 successful enrollees, and 7 attendees. 11 enrollees, 9 attendees. I was pretty surprised that they were similar, considering the one in January. A lot of folks expressed concerns about, again, transportation, the condition of the roads, the condition of the sidewalks, because they just don't get a lot of upkeep. And so it was also something I noticed is that was mostly local residents. When we stay in that Osceola area, the St. Croix city, a lot of those, I think we only had one person in the January class that wasn't directly from the city that we were holding it in. And so we run into these barriers and this is going to that Burnett thing I was kind of talking about, is Burnett is quite a bit north of us, an even smaller county with even further spread cities. Getting classes up there is difficult because we run out of centralized locations to host. Because a lot of folks, they might go to Webster, but you're not collecting anybody from any of those surrounding cities because it's 20, 30 minutes to the nearest venue. And a lot of them will even reach out and talk about how, their vision is not good when they're dealing with even rain and fog. So sometimes you're running into issues with seasonal barriers, even in spring and autumn, which really compresses the amount of time that you have to get those out on the ground when you've got people that need to do a lot of transportation and driving, especially when they're on these roads that aren't well cared for. The infrastructure is just not friendly to them. And so that kind of also leans into the securing guest experts for stepping on. We tried to run one in October that had to be canceled because we could not find anyone who qualified for the vision expert necessity. We've reached the point where I am currently calling people as far as 45 minutes to an hour away to see if anyone is willing to come do that. I have called pretty much every option that's in our county. And in Burnett County, the gentleman who did it for our last class and who is doing it for this class is coming from Superior, Wisconsin, which is several hours away. He's from the Office for the Blind and Visually Impaired. But that's something that we run into quite a bit, especially also with the medical, like a lot of the professionals that, they're full-time employees, they're working in clinics, they're already up to their eyes trying to just get through what they have. So getting them to come do this can be difficult. Meeting those minimum registration requirements, like I said. We've also kind of bumped into issues with the preferred methods of class versus expanding options using virtual, which I think kind of leans a little bit into struggling with accessing some underserved populations. We have a lot of Indigenous folks around here, and we have, obviously a lot of men, but a lot of those folks, we're having a hard time getting them, partially because a lot of the Indigenous population is in Burnett County. The volunteers we were able to get, only 2 of them one of them is allowed to do it in Burnett. The other two are Polk County employees who cannot go teach that in Burnett. And so we're just kind of bumping into this issue of being like, how do we access, you know, the indigenous folks? How do we get to these men who are oftentimes, we run into a lot of them, I've noticed in other programs, they're very proud. A lot of the hardworking farm guys out here, you know, they're very much like, I'm all right, you know, I'll be fine, I got it. I've been trying to push it in places that might seem a little peculiar, farm equipment stores, golf ranges, places like that, hobbies that you're going to run into that you need to be able to walk for those. It so far has not been particularly successful. We've had one gentleman who's stepping on, and he happens to be married to one of the other participants. We're also just another problem that I run into is we're a very white community outside of the indigenous population in Burnett. We just do not have a large population of Black and other POC people. And so finding the demographics of those folks being small and oftentimes, you know, a little bit harder to just, like, we don't have a lot of groups for like LGBT, same issue. Don't have a lot of groups in the area. I can't go to a community center and be like, I know that this group is here today because they're doing, you know, some sort of event. So getting those populations has been really, really hard. Excuse me. Successes we've run into with marketing, both in the realm of getting people to sign up for these programs and also getting people to volunteer for these programs or just be more aware of them. We've had a lot of success with old school methods. You can see here with July and January, I don't have any data for January, but it's been primarily passive advertising. Word of mouth is a big one. Callbacks from the ADRC, like I said, I reached back onto that callback list. And then flyers, while they have not, there's not a lot on this one here. We've had a lot of success with flyers for other programs. It seems out here there's still a fondness for hard copy, old school, like direct contact kind of thing, which is why it's been nice working with our community partners, our libraries, our senior centers. We also have residents who are involved in the community and folks who are very chatty because being rural, being small, there is that, you know, everybody knows everybody thing going on that, you know, you run into. So if you can find the right individuals who, you know, maybe they're also on the fair board, or, you know, maybe they're also a volunteer in a different organization, or maybe they work at the post office and they will talk to you for 20 minutes. Those are the people that I try to encourage people, and I myself try to encourage, like, getting that directly to them. I'm talking to someone at the grocery store, I'm bringing this up. You know, I'm talking to someone in a different department at work, I'm bringing this up because it does get around like that. Whoops, my apologies. Appeals to previous program participants and captive audiences, those kind of go together. Those captive audiences you run into with senior centers, our dining site, going and like talking to them. Senior living centers, a lot of times will go directly to the individuals who are kind of managing those buildings and be like, hey, get this out. And then you get that word of mouth, you know, when they're sitting together in, you know, the dining hall, they're mentioning this. I've had a couple instances where folks have been like, hey, I brought my neighbor in the room next door. And so those captive audiences are nice. They can be helpful. Those previous program participants are also a captive audience. You know, when they come in, when they join Stepping On, they get their little swag bag, they get their file folder with all their necessary stuff, but then they also get, you know, a flyer for another program that we're running. So if they're going to Eat Smart, Move More, Way Less, I'm letting them know about Stepping On. It just kind of feels like one of the biggest things is that it needs to be a constant process when you are in a rural area because you don't always get the level of traffic, you know, in certain places. You don't have as many resources to like kind of lean on each other. We do a lot with churches and libraries, but a lot of our senior centers are not super active. They can be part-time because there's just not bodies to run them. And so just making that like constant seems to be one of the things that's been most helpful for us. Marketing flops, you know, I've tried some things that just haven't seemed to pay off quite yet, or don't seem like they're quite as efficient as I'd like. Radio is one that is brand new to us, so I'm hoping to see some improvement maybe once we do that a little more. But so far, radio has not been very helpful in getting this information out. again, it very well may be that a lot of our demographic doesn't like to do a lot of driving, which is where a lot of folks listen to radios. Newspaper ads are kind of hit or miss. They can be pricey. We found that yellow page inserts are super successful for a lot of other things. They're a little too expensive for individual programs, but what me and our DCS, our dementia specialist, have been doing is making like full pages with every program we offer on there, or what we're planning, and then kind of loose date. So it'd be like, hey, we're offering stepping on in May and August. Keep an eye out, save the date type thing. But other than that, newspaper just hasn't been super successful. I found that if you do it, press releases are nice, and a lot of them in smaller communities, they run these community calendars for us. We have a small one that's just in that Osceola town, and they run a community calendar and they put it in for us for free. Social groups are hit and miss. You got to make sure that that they'll discuss it, announce it, and post it. That's something I run into with the churches is I don't know when they get that information, if they're giving it to their congregation or not. Once it's out of my hands, there's nothing I can do with that. So it's not my favorite way, and it doesn't seem to be the most successful. But places like the more active senior centers, I know that they're bringing that up because that's the demographic. That's what they want. We work with them regularly. I would like to move forward into trying to talk to some of the people like the Lions Club in the area, some of those places. But that's something that is a 2025 objective. That's not something I've tried out yet. Social media has been hit or miss. I like to lean on it heavy for virtual programs because out here, there's not a lot of services to help people with understanding their technology. We get calls for it kind of often. And it's just like a library here and there that maybe has like an hour or two a day. And so when I advertise on Facebook, I really push that for virtual programs because those people are already equipped. And it's really handy for those long distance places. Eat Smart, Move More, Way Less is a voucher system. And then it's something they do at home virtually on the computer. And I've seen to get a lot of people from like Northern Burnett, where it's 30 minutes between towns. It's usually pretty rural stuff. They seem to like that. So it's just a matter of making sure that I'm marketing to a virtual demographic when I'm marketing a virtual program. But there are a handful of folks that have actually personally kind of surprised me at the level of their tech skill, which is great. I'm running my first virtual class right now, and it's been fantastic. So it's just, I think, a matter of marketing to the demographics that are capable. And like, if I was just putting flyers up, I might not get anywhere with that. So like a virtual stepping on might not be as successful. So new considerations for 2025 is I'd like to just increase that active marketing to those captive audiences, because that has been pretty good. You can sell that program, you can put the energy into it. It's not just like looking at a flyer, you're like, this is why stepping on matters, this is why you should come. I know it's a long way, I know that it's kind of autumn, but you can really kind of work them through those apprehensive angles that we keep running into. I would really like to just generally increase fall prevention education and try to especially get some more focus in on those men, because we just don't, I'm sure a lot of you run into the same thing, but like all of our demographic information on our social media, the people that I see all the time, the people that are attending our classes, very, very, very heavy women. Almost no men. Once in a while we get them at like caregiver events, but I'd really like to start trying to bring in some of them. So it's just a matter of figuring out how to market to them. So if anyone has any ideas on how to get to men specifically, I am all ears. Like I said, making those marketing program or the efforts for those programs a year-round effort is something that over the last year and a half, I've kind of learned it just needs to be an ongoing thing, because if it's not ongoing, I don't have enough time to get enough information through the community for long enough to hit enough people. It's difficult because I don't have 30,000 people in my city. I don't know if I have 30,000 people in my county, if I'm being completely honest with you. So it's just kind of getting those people. And then finding a way to increase the appeal of like the fall risk screening events, which is something that we have tried to run. We were doing them every second Tuesday, or the second Tuesday of every month, I apologize. and we just weren't getting people in. We offer them at events all the time. We have a health fair coming up here. We do them at the county fair all the time, every single year. And we get maybe one, two, possibly in a whole weekend. Some events we don't get any, and I'm not sure how to increase the appeal of that. We've already tried to make it really clear that they're very simple, they're very fast, they're very beneficial, and we just can't get people enticed. We were even offering free subscriptions to our newsletter at one point if you got one, and we still could not get people in. A lot of interest, but no follow through. People will run it, they're like, oh, I should come in, and then they never follow up, or I'll come back on my way out, and they never do. I just don't know what to do about that one, unfortunately. I think it could be really beneficial out here too. But final thoughts on this is you can see a copy of our full-size flyer. Post that one around a lot in town. Like I said, a lot of them like that old school. So you put it up at, I find like libraries are great, post offices are great, gas stations if they have a good board. Some of them don't have good boards. Food shelves, knitting stores, anywhere that it's just right there in their face and you're going to see a lot of traffic, or you're going to see your demographics specifically. Pardon me. And so, like I said, that distance and travel and the weather, that seems to be one of the major components of people that I talk to not wanting to attend. When I have people, call about it, they're like, well, I don't know, it's in January. And so it can be kind of frustrating because they don't want to drive on those roads, and I don't blame them. But when you get, especially like in the winter, you're like, okay, you've missed 4 classes out of 7 because the roads are just not what you would consider safe enough for you. We have talked a little bit with our transportation services about maybe doing like pickups for classes and being like, okay, we're hosting this class, we're picking this group up to bring to it. But that's not something that we've got in motion quite yet. Our transportation department is going through like a lot of changes, which are positive changes, but it's just been a little bit much to try to put more program development things on top of them right this moment. That old school still seems popular, the word of mouth and the physical materials. I think word of mouth, that active advertising is really where we need to start going with that. We've been a little more passive the last year, and it's just not turning the results that I'd like to see. Whoops. And then, yeah, the big one is, and I'm sure you guys all do it too, but like gathering the data's been important for me because it's helping me find these trends. It's helping me find what is and isn't working. And I like to call it professional persistence, but I push a little bit to get that data from them. Remind them at the beginning of class, remind them at the end of class. Make sure that when the series starts, you're asking them, series ends, you're asking them. Any evaluations or things like that, make sure that data information is on there, because if you don't know where they're hearing about you, especially like places like this where you don't have a ton of places that you can just be going and advertising. Some things they just don't get a lot, like a billboard. There's a lot of places that a billboard wouldn't do us any good. A lot of people don't travel those roads, back roads. So just making sure that data is coming in and is being tracked, even if it is incomplete data. If only half your class gives it to you, anything is better than nothing. I think there's a lot of things that I probably would not have recognized were not benefiting me if I hadn't been doing this. I've been kind of wasting money on some advertisements in the newspaper that aren't turning out any results. And then here's just our little, we have a small banner one that we put like on the homepage of our website. We put it in our newsletter. I try to start marketing 3 months in advance, sometimes a little bit longer. But that doesn't seem to be giving me enough time. So moving through that persistence, that constant advertising, even if you're not giving them a date, just it's always in their head. They see the same ads again. They hear about it all the time. Every other month it's in your newsletter, things like that. You don't want to overwhelm them, but it really helps it stick. And then they bring their friends with them. They're like, hey, my neighbor, come with me. Friend, come with me. Sister, come with me. Mom, come with me. So I think it's just, I hate to say it, but just driving it into their memory and making sure that they know about it and it's always there for them. And, they're remembering your presentations, they're remembering your flyers, because that's what makes them go, oh man, like I almost slipped on the ice. Maybe I should take that class. But that's all I got for you guys.
Thank you, Simona. I know you talked a lot about barriers in your presentation, but what I also heard were a lot of successes because you were trying so many different things to reach the underserved populations in your rural county in northern Wisconsin and really finding out what worked for you. So I really appreciate all of your, you know, challenges, but then also strategies that you've tried and sharing all of those helpful tips. So thank you for that.
Thank you.
Yeah, I'm really curious. I'm glad I'm not in that position, but
now that we are where we
Okay, well, I wanted to, oops, I'm gonna go to the right slide here, give some quick Falls for Wisconsin updates. And then I promise we'll have some time for local updates as well. So moving into 2025, inviting anyone that is interested in joining a workout group and getting more actively involved in the Falls for Wisconsin Coalition. On the screen here, you'll see what our current work groups are. So we have public awareness and education, data collection and analyzation, and our new work group for advocacy. And Jill will be sharing a little bit more about some of the legislative advocacy that is happening throughout the state for falls prevention. But if you are interested in joining one of these work groups, please let me know and I'll get you connected with the work group lead. Currently, I lead the public awareness work group. We will have two individuals, Margaret, who is the DHS state trauma coordinator, and Will, who is a preparedness and emergency healthcare epidemiologist, taking over the lead of the data work group after the first meeting of this year. And then Jill, like I said, is leading the advocacy effort. So definitely let me know if you're interested in getting more involved in those. I also just wanted to briefly share about some of the media campaigns that we have. So the first one that we have, which is on the Falls for Wisconsin website under the promotional resources. These are some social media graphics and suggested messages that have been used in the past, but are still relevant for winter safety. So there's a whole social media winter campaign that's on that promotional resources page. And then the awareness work group is currently working on the release of another campaign, which should be out by early next week. And I just put on the right-hand side a screenshot of a couple of the graphics. And the focus of that campaign is related to, what if you do fall? How do you get up from a fall? Who do you call if you do fall? So we'll be sending out that campaign, like I said, early next week. They'll involve some stuff for caregivers and also planning for doing a webinar for older adults in late February. So just finalizing some of those details. I know it's a little bit of a shorter turnaround and shorter notice since February is coming up real soon, but definitely feel free to use those campaign materials past February into March and later on throughout the year too. But again, more to come on that campaign early next week. But the one on the left is already available and can be used. I'm going to pass it over to Jill for a quick legislative update.
Great, thanks, Suzanne. So just a little, let's see, I'm trying to remember the last time we talked about this, so I'll provide a kind of a brief overview here, and if anybody has any additional questions, I'm happy to answer those. So just a recap, in 2023 and 2024, we did some legislative work where we introduced two different bills, one in the Senate, one in the Assembly, to try to fund what we called healthy aging grants. And what that legislation aims to do is to provide funding for the Falls Free Wisconsin initiative for basically statewide oversight and coordination of healthy aging programs, of all healthy aging programs, but our focus really was on fall prevention and making sure that we can continue these statewide efforts, as well as be able to continue to fund localized fall prevention efforts. So if you remember the LEAF grants that we did back in 2024, to provide funding for fall prevention efforts in our local communities, some innovative strategies. So that's a brief overview of what we're looking for funding for. What happened in 2024 is that we had great bipartisan support for these asks for the healthy aging grants. it may pass through both the Senate and the Assembly Health Committees, as well as the Senate at large. So it was all, like I said, lots of support. There was no one opposed. But what happened is then the Assembly ended their session early, so it was unable to go through the whole process and actually get approved. So we essentially ran out of time last year. So what we're working to do is working with our partners to be able to reintroduce the bills in this new session. So we are the twist of it now this year is that the senator that kind of championed this work in 2023 and 2024 is no longer working on health related bills. So we are looking to find a new champion. We're meeting with Senator Cabral Guevara, who is in the Oshkosh Fox Valley area. We're meeting with her. She's also the chair of the Senate Health Committee, so she's a great choice for somebody to champion this. We are meeting with her on January 15th. So my ask to you all is if you are in her district or if you know of anyone who is in her district and you can help maybe promote, maybe make some asks, just kind of be on hand if we need some support with asking her for her support. That would be my desperate plea for asked today. We do have some partners that have worked with us in the past that are no longer able to work on that. So we really could use support in that area is my number one ask for today. And then knowing that going forward in 2025, we will be continuing to work on this. Once we find our champion, then we'll again be looking to this group, to our network, to when we do have other asks, when we do have other opportunities, maybe if somebody's willing to come and provide a testimony, we need stories about impact of your fall prevention efforts in your community, and really looking to highlight the great work that's happening and how can we continue to support that. So success stories, example stories, please, if you're interested in that advocacy committee, that would be great. If not, and you just want to email me and say, hey, whenever you need me, just email me and I'd be happy to assist, if something comes up. It'd be great to have just kind of a list of people who are ready to go and ready to send an email if needed. I promise I'll make it as easy as possible for you and I'll draft all the language and things like that, but we definitely need some local voices in this process. So that is my legislative update for 2025.
Sorry about that. When did you say you're meeting with Senator Cabral?
Yeah, Cabral Guevara. I can type her name in the chat, but she is in her district is
she's my district. That's why I wondered.
She is. Okay, yeah. So our meeting with her is the 15th, January 15th. So if anybody wants to come to that meeting with me who's in that district, that would be amazing. If not, maybe just an email letting her know that we have some support. Go ahead and email me and we can figure out the best strategy for that.
Thank you.
Thank you so much.
Awesome. Thanks, Jill.
Yeah.
Two more very quick updates, and I'll leave about 4 to 5 minutes for local updates. So like Jill had mentioned in the chat, we are holding our Healthy Aging Summit on May 15th. And part of that is a call for posters. So the poster application deadline is the end of this month, so January 31st. And we really invite you to showcase your work and all of the exciting things that you have happening in your local communities, whether it's related to falls prevention or related to other work that you do to promote healthy aging for older adults. But you can find all of the details at our WEHA website under the For Professionals tab. There's a link there for the Healthy Aging Summit. So just wanted to share that with everybody. And then last but not least, for Falls Free Wisconsin Coalition updates, a long time coming. I've shared about this in the past, but we are finally ready to release the report related to older adult alcohol-related falls in Wisconsin. So excited for this to come at the end of this month on Thursday, January 30th. We'll have some presentations related to the data, related to emergency department visits and injuries of alcohol-related falls. and education about alcohol as we age. So the report includes information on the health impacts of alcohol, the statewide alcohol-related falls data, cost of alcohol-related falls. There's alcohol-related older adult falls data by county, resources for professionals, and a one-pager for older adults about the topic. And then it goes into, the methods and limitations behind the data. So on the screen, you'll just see a data summary snapshot from the report, but excited to share this out towards the end of this month. And after the webinar, the data report will be released and available on the Falls Free Wisconsin website. Okay, like I said, very packed agenda, but I do want to leave some time. If anyone does have any thing that they want to share related to falls prevention, on the screen you'll see upcoming events, questions, challenges, successes, whether it's related to the topic of reaching underserved populations or other things that are happening in your community. Feel free to drop in the chat or come off of mute, and I'll leave some space now for that.
I'd like to share. So this is Kim Lombard. I work at Frederick Hospital out of Milwaukee, and we have we offer Stepping On. We do have a virtual workshop coming up that actually starts next week. We are a little bit low on registration, so right now we're kind of looking. We're at risk for canceling. So I'm gonna put the flyer in the chat and then the link to register. If anybody has people that could perhaps or might be interested in taking it, we would certainly appreciate you forwarding it. It is a free workshop. We're doing this in the morning session, and with virtual workshops, they do need a tablet or a laptop. We do kind of help them through that process with checking their technology and getting them comfortable accessing the web link. So we do provide some assistance with that. But anybody who knows people that are interested, it'd be helpful just to spread the word. So we never want to be faced with canceling classes if we don't have to. So thank you.
Thanks, Kim. I see those links in the chat, so thanks for sharing that. No, we're running short on time, but anything else that anybody wants to share?
I'll raise my hand.
Go ahead, Christy.
Christy Halsey from UW-Madison DPT program. I've been working in Milwaukee for a while with an inclusive Tai Chi Prime program. We've trained a bunch of people over there. We're doing a really small mini project research study. So I was interested in your outcomes group. I'm really looking for somebody who wants to do outcome data collection in like central Milwaukee County for Coral Central, 16th Street Clinic. That could be my lead person over there. So if there's anybody on this group that lives in the Milwaukee area, knows somebody who just has some time to do some data collection, they can contact me at the university.
Christy, have you at all been involved in the Milwaukee Fall Prevention Coalition?
Not directly, because I'm based in Madison, right? So I've been working, pretty much with these small nonprofit groups, but we did mostly training. We trained a bunch of people to run the program, and then they started doing their own community classes. And then through focus groups, they decided what they want to do a research pilot on. So that's where we're at now. So I haven't really directly worked with anybody.
I'm going to put my email in the chat. I'm on the steering committee, but this could be a topic that would be interesting to the coalition, at least, one, to know what the work that you're doing in Milwaukee, but also see if we can help connect you to people that might be interested in that data collection piece. But I'll put my email in the chat, and then we can talk a little bit about, and I can get you connected.
Thanks, Kim.
You're welcome.
Yeah, and Christy, if you want to send me the info, I can also share it out with the larger coalition.
Okay.
And see if anyone else is interested. I do see in the chat, Lucy, Waukesha County Falls Prevention Coalition will be celebrating their 1-year anniversary in March. So congratulations, that is awesome. And that does lead us right to 1 o'clock, unfortunately. I promise in future meetings, I will leave more time for these local updates. Did want to just mention, Shari wasn't able to make it to present on reaching Hispanic populations for falls prevention, but another plug for WIHA's Healthy Aging Summit. She'll be presenting then. Contact information is on the screen and the 2025 meeting schedule and registration link. But thank you all for all of the great information the presenters shared during the meeting and all the connections happening throughout the state, and hope to see you at future meetings. Again, reach out to myself if you're interested in getting more involved, and to Jill for any advocacy efforts. Thanks, everyone.
Thank you.